Hello, everyone. Welcome back to the Beat Podcast. Saul Marquez here, and I am thrilled to be at the health show with no one other than Liana Guzman. She is the CEO of Folks Health, and Folks Health is a category-defining digital healthcare provider delivering affirming care to the LGBTQIA+ community nationwide. I'm so thrilled to have you here on the podcast, Liana. Thanks for joining.
I'm thrilled to be here. Thanks for having me.
Of course. You guys are doing very important work.
Thank you.
And I'm excited to dig in. Let's talk about it, right? One of the driving questions here at Health is reimagining care delivery to improve access and outcomes, especially for historically underserved populations. Talk to us about how Folks Health is doing that.
Yeah, so I always like to start by saying we actually think we're building the future of healthcare writ large. So for us, we think healthcare in 20 years will have three things that will be true about it. One is it will be whole person. So I think we're going to look back and think it was crazy that we used to separate the mind from the body. Part of what we think the future will be is that you will go to the same practice for therapy and primary care, or at least that where you go for those things will be interconnected.
Yeah.
The second piece is patient-centered, right? So I think for far too long, we have undervalued people's own experience in their healthcare journey. And we think the magic happens when you combine clinical expertise with the expertise of somebody who has lived in their body and is out in the world. And when those things come together, that's when you can actually drive better outcomes. And then the third piece is community orientation. So I think the reality is that our community has as much or more to do with our health and wellness as almost anything else. And so for us, we think tapping into that community as a driver to better outcomes will be a big part of the future of healthcare. So we are building a platform that does all three things. We happen to be doing it for the LGBTQIA community, but that community is the fastest growing demographic in the U.S. So it's 1 in 10 adults
really?
in the U.S.
Oh, I didn't know that.
That's
cool.
So it's 10% of the adult population today. It's 25% of Gen Z.
Wow. Oh, wow. Really? Holy smokes.
That's the reaction we often get when we give people that statistic.
Wow. Impressive. Yeah, didn't know that. And fascinating. And by the way, I love the framework. All those things should be true today.
They should.
They're not. And there's different names for them: community, social determinants of health.
Totally.
And so I love how you've simplified this concept. That's actually quite difficult, but it doesn't have to be. There's a lot of technology happening here. There's AI everywhere.
Yeah.
Let's dig into that a little bit with your vision. So with so many emerging technologies shaping the future of healthcare, how do you decide which innovations to invest in, and how do you measure their real-world impact?
So we always start with our members. So we started as a direct-to-consumer cash pay business. And the reason we did that was we wanted to make sure we were building something that people wanted. And I think the best way to know that is, are they willing to pay for it or not? And so at the core of every decision we make is the member that we're serving, right? So by virtue of having a really clear understanding of who we're targeting, and then importantly, who we're not, right? It allows us to be really laser focused on ensuring that we are giving them what they want and what they need and what they deserve. And so when I think about technology, it really is ensuring that it is in service of that mission versus jumping on the next shiny thing. So when you think about something like AI, and I previously worked in cryptocurrency, so I know what it is like to ride the wave of the hot new shiny thing, right?
Yeah.
And there's a lot of value to be had from AI, I believe, but I also think a lot of harm can be done. And so for us, it's about ensuring that we're really understanding where it can be beneficial versus where it can actually, I think one of the big dangers with AI is if we're not really thoughtful about regulating it and we're not really thoughtful about the inputs, I think it will allow us to scale inequality at a speed that we've never before seen. And so I'm really hesitant about a world in which we're just deploying AI into healthcare blindly. I think we have to take a really thoughtful approach. We see this, and there's so many statistics that show that brown people, LGBTQIA people are not only not represented in it in large language models, but often are represented in ways that are directly harmful. And so I think for us, it's about being really thoughtful about which things we think are going to drive us forward and how can we help ensure that the broader movement is not forgetting about us.
Yeah, that's fascinating. So you guys started as cash pay. Tell us a little bit about the model and like what do you deliver and where you are now?
Yeah. So we started as a subscription model, all inclusive. It was a certain amount of money per month, and that included any visits, medications, labs. We evolved away from
like direct primary care.
Yep.
Right? Like DTC.
Exactly.
Yeah.
Exactly.
Okay.
And frankly, our earliest days were really almost exclusively focused on gender-affirming hormone therapy for the trans community.
Oh, okay.
We always knew that we were going to care for the whole community, but we wanted to start with the community, the segment of our community that we felt represented the greatest need. So we started there. About 2 years ago, we pivoted into a membership fee-for-service model. And we did that because we know the vast majority of Americans access healthcare through insurance. We could not accept insurance in a subscription model. And so we shifted so that people could pay for their visits using their insurance coverage.
Got it.
To make it, to your point around accessibility, more accessible for folks. And so we have a membership model today. You pay for the membership. That covers the community platform where you can access information. You can connect with other members. We have therapist-led groups that range from navigating anxiety to building better sleep habits. We have peer support groups. So that in and of itself is very valuable. It also gives you access to being able to see our clinicians on both the primary and mental health side and access to our care navigator. So for any care that we can't provide digitally or via telehealth, we can get you to somebody who can, who's been vetted. And then that care, you can either pay cash or we can run it through your insurance.
Super cool. I love that. Thanks for sharing that.
Of course.
And then the second question that I had as a follow-on, you answered with the data, but to be clear, so what is the harm that could be done with the data? I'm just curious about that.
Absolutely. I'll give you an example that's, I think, front and center for me just because of the recent Supreme Court case. If you go into AI and you ask for information about conversion therapy for a very long time, and I will say there are organizations like GLAAD that are helping to change this, but for a very long time, the data was directing you to places to get conversion therapy. That's really dangerous. We know medically it does not work. It leads to increased levels of suicidality. That is not factual information that people are being given, and it is deeply harmful.
Looking ahead the next 3 to 5 years, what bold bet is your company making that you believe will truly transform the healthcare experience?
I sometimes talk about what we're doing as a tsunami, where when you hear about people talk about tsunamis, the birds fly away, the animals all know it's coming, and the people are often on the beach sunning themselves, right? Yeah. And I think that's what's happening. Analogy. I think there's a looming crisis. I think those of us in this community are saying there are more of us than exist. We are not well served by the incumbent model. And in fact, it is often openly discriminatory or violent against us. We need to do better. And not just because we want you to treat us with dignity, which of course that is a chief part of what we want, but actually the system cannot withstand. So just to give you a couple of statistics, 40% of members in our community do not pursue healthcare. They avoid healthcare because they don't trust the system or they've had violent or traumatic experiences. That leads to 200 times higher inpatient admissions. That is a cost that the system can barely take on now. When you think about that going from 1 in 10 to 1 in 4, I think the system will fall apart. And so the bet is not so much a big bet, but it is my deep belief that people are operating under this really misinformed perspective that this community is small and that our needs are not different from non-LGBTQIA counterparts. And I think a lot of that is actually comes from a place of kindness. Some people feel like, well, I don't see you as different from me. Why would we need different healthcare? And my argument to that is, well, actually, I think all of us, to your point at the beginning, we all need better healthcare. But for our community, we need to walk into spaces that we don't have to explain our realities to, where people know who we are and our lived experiences, so that we can then really focus on moving into taking care of ourselves. And so I think that my sort of big bet is that people in the next decade are going to become aware, partially because they will have no ability to ignore just how woefully unsuited the existing system is for caring for our community.
Wow. Yeah, no, that's a really interesting perspective. Definitely one that we should all be thinking about. Have you been to the patient pavilion?
I haven't. Is it worth going to?
It's worth going to.
Okay.
And it's all about this. It's all about like being seen and heard by somebody that you don't need to explain anything to.
Absolutely. And we see the outcomes. Like 100% of our members feel seen by our clinicians. 99% feel like they're making meaningful headway towards their health goals.
So great.
When you come to us with suicide ideation, 59% of the time, we can get that fully resolved in 3 months. And that's in a telehealth solution, right? It just, when you start from a place of trust and understanding, I think your ability to drive improved outcomes just grows exponentially.
100%. Yeah. Okay. So DTC, we've talked about it. It's often code for marketing. And there's often a pushback that telehealth is not as safe and impactful as in-person care. Tell me why. This stat that you just shared is a big one, but tell me why you think that's wrong. And where does the telehealth reach its limit?
Yep. This is a question that we get asked a lot in the healthcare space. And I find myself wanting to say to people, we have to stop caring about the how and really focusing on the outcomes, right?
Yeah.
If the goal is how do we get people to live their best lives, it shouldn't matter how they access that. And for me with telehealth, the reality is for a lot of people, it is the only way that they feel safe, right? Like if you're a trans person in certain states in this country, having to leave your house to go to an office where you don't know what people think of you, and then having to walk to the pharmacy and collect a medication and have people around you as the pharmacist is asking personal questions that they shouldn't be asked, that is not just uncomfortable, it can actually be unsafe. And so a telehealth experience in that setup means that is the only way that you feel comfortable accessing care. I think about, I grew up with a single working mom who could either take a day off to chaperone my field trip or could take a day off to go to the doctor. So what do you think she did? She took the day off to chaperone my field trip, which meant she skipped doctor's appointments. But if she could have scheduled those doctor's appointments during her lunch break, she would have seen doctors more frequently and had better health outcomes. And so I just think across the board, we have to start with the patient. And health is one of the only places where the expectation is that we shouldn't live our lives powered by technology, right? This duality of everybody really excited about AI.
Yeah.
But no, we must still see you in person at all times.
Right.
And at some point, we have to have a reckoning that you can't be excited about one and so dismissive of the other. It really has to be what technology is going to help us get to better outcomes. It, of course, reaches its limits, right? You can't conduct surgery via telehealth.
Right.
There are certain things that you need to be able to go do in person. But I think even that is going to be shifted by technology. Like, I think we're going to get to a place, we're even seeing this with, as an example, flu and COVID tests. A decade ago, if you were sick, you had to make an appointment to go, and the doctor would give you a test. And most of the time, they didn't even give you the results immediately. They had to send them out. And now you can swab yourself at home and call a physician and show them the test, and they can prescribe Tamiflu. And it's not just that was convenient for you. It means you didn't walk into a pharmacy and a doctor's office and get other people sick.
Yeah.
So across the board, I think obviously there are limits. There are things we have to do in person. But I would argue that the vast majority of care can be done digitally.
Yeah. And listen, I think most of us prefer it that way.
Great.
I just did my labs and they came to my house.
Yep.
I don't want to go sit in a LabCorp or somewhere else or Quest.
Totally.
Yeah.
I think it's absolutely. I think people prefer it. And I think everybody wins. I don't know what the reticence is, right? Like, I think we're seeing that we're having to shut down hospitals in rural areas because we can't afford to keep them open. But then in the same breath, we're saying we shouldn't tap into telehealth. I think something's got to give, and we have to just start being forward leaning.
I agree with you. And I think many of our listeners who are in the innovation space also agree with you. So you're in the right community here. Back to your community point. So paint the counterfactual. If payers, employers don't invest in affirming community-backed care, as you've been sharing with us, we can benefit so much from, and I agree. What goes wrong clinically and financially over the next 12 to 24 months?
Yeah, this is a question that's really top of mind for me right now, because particularly for the community that we serve, you are seeing a pullback from a sort of on the side of corporations who are worried that in this political environment, if they are seen to be supporting marginalized groups, they could be made to pay in some way or another. And what I would say to them, and what I do say to them, is I think the risk to not caring for this community is significantly greater than the risk to stepping in. And it's not just the cost, right? So I mentioned earlier, I think we exist. So it doesn't matter who's in office. It doesn't matter what politicians say. We exist. We've always existed. We're always going to exist. And healthcare is not something you can avoid, right? So when I say 40% of our community avoids healthcare, what I mean is they avoid preemptive healthcare. They get sick care, which is much more costly for everyone.
Yes.
And so when I think about these conversations, a lot of what I'm trying to get people to understand is not only is it short-sighted to not be thinking about ways to care for this community preemptively or be ahead of the curve, but I really believe the pendulum is going to swing. When you look at the demographic shifts, when a quarter of Gen Z identifies as queer, those folks are going to have a big say in the future. I think there is a real value to be captured by those companies who step in when it is not convenient and support this community. And those companies that do that, I think, will be receiving the dividends of that decision for decades to come. And those companies that opt to take a step back, I think we'll have a very hard time catching up and overcoming those companies. So I think that the decisions that companies make today will inform their ability to succeed in a decade. Those who don't, I think, do so at their own peril.
Yeah, I agree with you 100%. And you strike me as somebody that tends to be ahead of the game by several years with your cryptocurrency background. And so, folks, put your ear to the ground. See and hear where this is going. Let's take some notes from our conversation with Liana here, and let's really be proactive about this because I think there's something coming, to her point. What's the biggest misconception about folks or LGBTQIA plus care that you wish more leaders understood?
It's twofold, and I think I've said them both, but to put it succinctly, we are not a niche community, right? If you took the spending power of this community, it'd be the fourth largest economy in the world. So we are large, we are growing, and we represent a meaningful opportunity for companies. The other thing I would say is that it is not risky to care for us. I know it feels like that right now. I know that it feels like there are a lot of very powerful people who are trying to instill fear in others in terms of standing up for our community. And what I would say is that when I or others have stood up and not backed down, we have benefited from that. And I think you're starting to see that. Like, I think Target is a prime example of a company who really said, we don't care about this community anymore. And they've been in free fall since then. And so I think it's that. I think it's, and those things go hand in hand. But only if you don't realize how big we are, do you believe that you can walk away from us with no price to be paid. That's what I wish people realized, was that we are not just a monolith on paper that is small. We represent such a rich culture, and we deserve to be cared for.
I love it. And when you use data to drive decisions, you can make decisions that are good for business, that are from the heart, that make a difference.
That's right. Like, I'll give you one last stat.
Yeah.
Employers who partner with us, on average, our members get 2 additional days per month for work and play. So that's like me handing a company another February.
Hold on, say that again. And
So the CDC has a healthy days scale. So it's an actual measurement tool by the CDC. And our members, on average, get 2 additional days per month, meaning they are healthier because they're not waiting until they get really sick. Because of that, they're often happier because they're not only not sick, but they're getting community and connection and mental health support. And that combination means that they are more engaged and productive in their everyday life. And that translates to work. It means literally that I could hand you a second February of productivity for your LGBTQIA teammates.
Come on, guys, you gals, what are we doing here?
That's what I'm saying.
It's possible to move the needle. The community is not niche.
No.
And now is the time. Liana, if people want to learn more about you, the company, like, where can they reach out?
We'd love for you to check out our website. It's folkshealth.com. So it's FOLX health.com. We're also on Instagram if you want to see the visuals of our community. Yeah, we'd love for you to check it out and reach out.
Brilliant. There you have it, folks. Liana Guzman. She is the CEO of Folks Health here at Health, recording live for the Beat podcast. Make sure you check out the show notes. So much value in the show notes. Stay in touch. Connect with her team. Let's make a difference. Let's not let fear drive us. Let's look at the data. And Liana came with some great data. Thank you so much, Liana. This has been such a pleasure.
Thank you, Saul. I really appreciate it. I might bring you on to chat on our behalf. You're great. Look at how you brought it all succinctly.
Anytime.
Thank you.
Thank you.